Can't hear you, Mayor.
Hi, everyone. How are you? Good to see you. Every time it's a surprise who will be here when you arrive in our room. But we have some exciting announcements. I'm going to just give an overview and then hand it over to some of our guests here. I wanted to start out by just talking briefly about the pretty heinous incident that happened last night at the Board of Alders meeting, and to let the public know that we will not stand for that kind of behavior. And our local law enforcement is in contact with federal authorities to conduct an investigation into this. And we're also providing additional training for our boards and commissions to make sure that this type of incident doesn't happen again. It's pretty shocking what people are willing to do, and we won't stand for it in the city of New Haven. We are at 1,160 cases with 37 fatalities. And the number of fatalities has jumped since yesterday, and the number of cases, because the state of Connecticut has started counting probable cases in addition to confirmed cases. And so a confirmed case is clear. It's a person that is tested positive for COVID-19 and actually had a test. But probable cases are people that have clinical criteria and epidemiological evidence that they have COVID-19. And so if someone checks both those boxes, then the state will indicate them as probable. And so that's why the numbers have increased since yesterday. Of the 1,160 cases, 1,129 are COVID positive and have been tested. 31 are probable. Of the 37 fatalities, 30 were tested for COVID-19 and tested positive. 7 are identified as probable deaths related to COVID-19, but they were not tested. One other small update, and then I'll talk about the work that we've been doing to increase testing sites around the city. Our traffic and parking department is working slowly to disable some of the walk signals that so that people do not have to press the button to activate a walk signal. So they will do those automatically. So there will just be a normal cycle where the walk signals will periodically occur during the traffic signal cycle, so people do not have to press the button. We've seen this done in some other cities around the nation as well. It's just a small step to try to reduce transmission of the virus. As folks on the call know, testing has been something that we've been prioritizing in New Haven for obvious reasons. It is a key tool to helping us beat the virus, not only by allowing us to understand who the virus is impacting, to equip people to self-isolate with that knowledge. But it's also a way that we can ensure that in the long run, we will be able to open up. And that is because as the decline in cases, which we presume will happen, starts to occur, if there are additional outbreaks, we can quickly test not only the individuals that may be symptomatic, but people they have interacted with, and quickly ensure that there's self-isolation so the virus doesn't significantly spread. Now, currently in New Haven, there are 2 major testing sites. And those testing sites are the Yale New Haven Hospital testing site, and then the recently opened CVS testing site. And thanks to our 3 partners on the line, we will be activating 3 more sites in the near future. There's 2 green stars on the map of the 2 sites that we know the locations for. The 3rd we're working on finalizing shortly. And our goal is to put these sites in places where there are hotspots to ensure that the sites are accessible to community members that may not be able to access these other two sites. And part of this is about allowing for people to walk to get tested rather than drive. And both the other sites, it's more difficult for people to walk. The second component is a matter of trust, that our community health providers have a level of trust that other entities do not. And so we've been very grateful for the willingness to partner from both Cornell Scott and Fairhaven Health. And the third party is Dr. Murphy. Now, Dr. Murphy has done testing and stood up testing sites in, I believe, Stanford, Darien, New Canaan, and maybe one or two other sites. Dr. Murphy, once we get to, you can share that. And reached out to us to express interest in helping us stand up additional sites. We're very grateful that you're adding to our capacity to test many more New Haven residents, particularly in areas where there are significant hotspots, so that we can help support the people that are most severely impacted by this virus that is clearly the Black and brown population in New Haven. So with that, I would like to start with Mr. Taylor. Maybe Mr. Taylor, you can, Dr. Taylor, you can provide some information on the site that you're working to stand up on Dixwell Avenue.
Thank you, Mary. Oh, that's not good. Is that better?
So far it is.
Okay, so thank you, Mayor. Oh,
are you on phone as well?
I am. Can you?
So maybe you can unmute the phone. I think you can press *6 on your phone, and then we can mute the computer. Oh, try that. Can we hear you now?
Can you hear me now?
Yeah.
That's much better.
Perfect.
Sorry about that. Thank you very much, Mayor. We greatly appreciate always the opportunity to serve New Haven residents. And yes, it is true that we will be expanding our testing, COVID-19 testing capabilities to our Dixwell location at 226 Dixwell Avenue. The hours of operation for that testing will be 8:30 to 4:30 daily. And we will be commencing operations at 8:30 tomorrow morning, and are very pleased to be able to expand our capacity to do that for members of that community. And would love to have had our clinical team, our clinical leadership join me today, but they're busily preparing for tomorrow morning.
And I know Cornell Scott has been doing some testing over the last month and a half, but we're excited that this will be much more available to the public in one site that's located right on Dixwell Avenue there. Do you have anything else you'd like to add, or should I hand it over to Fairhaven Health?
I think those are the highlights, Mayor. Just want to thank everyone for the opportunity to bring the testing and make it more available to people in minority communities.
We appreciate that. Don't go anywhere, because I'm sure that the press will have a couple of questions for you.
Thank you, Michael, for your contribution and collaborative efforts. We're grateful for that.
Pleasure.
Very grateful. Dr. Lagarde.
Yes. Thank you, Mr. Mayor. So at Fairhaven Community Health Center, we too are opening a walk-in facility starting tomorrow morning at 9 a.m. One of the things that community health centers do is that we're in the community. We've built trust, and we're hoping that we can leverage that and bring in folks who might otherwise not, might be fearful of testing or might not be able to access it. One of the things we've learned through collecting what we call social determinants of health is that fully 30% of our patients report that they have transportation issues. And it's striking that throughout the state, the vast majority of testing sites are drive-through in a time when we know that COVID is disproportionately impacting communities that are primarily minority communities. So with that in mind, we will have a walk-in site at our 374 Grand Avenue location, which is our main location in New Haven. We are asking interested patients, residents, to call in advance so that we can give them a slot so that they are not kept waiting. We anticipate seeing a patient every 15 minutes for the hours of operation, and we have the flexibility to expand those hours as the need demands. Again, I think that's pretty much covers, what we're proposing to do. Hopefully, we can meet the needs of our community. That's what we're there for.
Thanks. And your site goes live tomorrow morning as well.
It does, absolutely, yes.
Great. Okay.
Thank you, Dr. Lagarde.
Thank you, Director Bond.
And Dr. Murphy.
Thank you again for having me. We're very excited to engage in a formal public-private collaboration with the city of New Haven. This is where I was born, so I'm very excited about being able to bring our services to the city. We agree with both the other doctors. One of the big shortcomings of drive-throughs, and we encountered this in Fairfield County as well, because we had bikes as well as people walk to our drive-through to be serviced. So I want to commend the mayor and the city for recognizing the true need in the city for underrepresented services here. And it's great to see the community rise up and answer the call. I'm very impressed. And we stand here ready to serve. We know that in short order, we will have the details of our site, the third site, hammered out very well. I think we have a good organization. I can't begin to thank the Department of Health and Director Bond enough for their tireless work to get these sites set up. And we stand ready to offer these services between the hours of 8 and 4. And wherever we are, it will be a place where we will make certain that we can care for the citizens of the city.
Thanks, Dr. Murphy. I appreciate that.
Yeah, thank you, Dr. Murphy.
Thank you.
I don't have anything else to add. Does the press have any questions? I see Mary O'Leary.
Hi. I just have some questions for how many patients, what the turnaround time they use for the test to get the results, both at Hill and at Fairhaven, and Dr. Murphy's.
Sure. So why don't we start with Dr. Taylor, and then we can go one by one.
I think the turnaround time, I just want to add a point of clarification, and then I'll get directly to respond to the question. We too are encouraging people to call to schedule an appointment slot. You can call our general number, which is 203-503-3000, to reserve one of those slots. We anticipate similarly being able to swab people on 15-minute increments, and as well that the turnaround time for test results will be about 3 days. Thank
you. Dr. Lagarde?
Pretty much the same. We've actually set up a dedicated line for this. It's in the flyer. I don't know it by heart, but we are booking people every 15 minutes. And again, we are hoping to just assess our capacity, both demand and supply. If there's greater demand, and if we can do it in a even shorter period of time, that will happen. I did want to mention that these services are open to the public. This is not just for patients of Fairhaven. Anyone who is truly, literally in the community or in New Haven, anywhere, who wants to avail themselves of the service can do so. And we will make sure that for positive test, there's the flyer, for positive tests, that if a provider other than a Fairhaven provider is identified, that we convey those results to the residence provider.
Thank you. And Dr. Murphy, the turnaround time for the test.
Yes, thank you so much, Mayor. We currently are using 2 different labs with an average turnaround time between 2 to 3 days. We hope to shorten that to 1 day, but currently we want to under-promise and over-deliver. And lastly, to echo the other doctors, our registration is online, and that's at coronatestct.com. The website is coronatestct.com. You can register there and set up for appointments to arrive at the walkthrough sites.
Thanks.
Thank you.
Any
I was
questions,
just,
Mary?
If I may, Mayor, excuse me, I didn't address that. Yes, the turnaround time, we're being promised 2 days, but to be realistic, 2 to 3 days is probably a fair commitment.
all right. Maybe Dr. Murphy's first name and also where you practice usually, and is this maybe something that's taking up almost full time to set up these sites in various locations?
Yes. So first name is Stephen with a V, right? And currently my practices are located in your neighbor county. We are in Stratford, Connecticut, Stamford, Connecticut, and also in Greenwich, Connecticut. We've closed the offices for general medicine to focus solely on delivering COVID care and testing to flatten the curve here in both counties.
Mary, I'll go to Tom, and then I think I saw Michael Bingham with his hand up too.
Thank you very much, Mayor, and thank you, everyone. If we could go to each of the healthcare providers in order for this question, I'd appreciate that as well. A few questions. Will these tests cost anything for patients to receive? Are there any criteria you are using? Do people have to be symptomatic or anything else? And who will be performing these tests? And which labs are used? I know that's 4, but if you could juggle those, I'd appreciate it.
Okay, if I,
Go for it. We can hear you, Dr.
okay,
Taylor.
I wasn't sure whether I was muted or not. We will be usually certainly Quest and potentially channeling additional tests via New Haven. Costs, we've chosen not to pay so much attention to the cost at this point. Certainly if people have insurance or are Medicaid recipients, we will be billing for the swabbing to take place. And so part of the, so there will be a registration process that allows us to do that. But we quite intentionally have chosen not to focus on the economics of the testing. We really are focusing first on making sure that people are tested and maintaining their health. And we'll figure out the finances later on. Our focus at this juncture is primarily on people's health.
And then before you move on, are there any criteria that you're using? Do people have to be symptomatic or can anyone make an appointment?
Quite typically, people have to be symptomatic because we do have a shortage of tests. So they will be assessed when they come for their appointment to determine whether they meet the testing criteria.
Dr. Lagarde?
Sure. So similarly, as you know, all of the commercial carriers, Medicare and Medicaid, there is no cost to testing. So the real issue here is with the uninsured. And several weeks ago, our board approved waiving of all fees for uninsured patients who are below the federal poverty level, which is the vast majority of our patients. So there is no cost associated with the testing. The criteria at our facility are symptoms or exposure. If a person feels that they've had a significant exposure by their own determination, we will test. We do also use Quest, and you asked who will do it? It will be our clinicians will be doing it. We'll be obtaining the specimen.
Dr. Murphy?
Thank you. To recap and echo the other doctors, the governor issued Executive Order 7U, which states that laboratories and providers may not bill for these services and that the insurance companies should cover those costs. That being said, the uninsured will not receive a bill from our services either. We agree that the community health is what matters most here. So those who are uninsured will not receive a bill. In addition, we also would like to take note that those who are undocumented may not have a license or identification from the state of Connecticut. We will accept them as well. They may bring whatever form of ID that they have. It's very important that if they're feeling symptoms, they should get tested. In addition, we will test those who've had exposure. We know that there's a significant incidence of asymptomatic carriers. Often they've had an exposure of someone, they can identify that, and so we will test for exposure. The laboratories that we use predominantly will be the Quest laboratory, but in addition to this, we also will be using LabCorp and a local laboratory called Semaphore, which is in Brantford, Connecticut.
Thank you.
Thank you very much, everyone. And Mayor, I have a few other questions for you and your team, but I'm happy to defer if anyone else wants to ask the healthcare providers.
So Michael Bingham said he did not, in fact, have a question. That's okay. That's okay. Let's go back to Mary, and then we'll go back to Tom. Maybe Matt McFarland will surprise us with a question this time.
I have a question on the mask.
You're very quiet, Mary.
Am I unmuted? Yeah, I am unmuted.
If you shout, we can hear you.
Okay. I just had a question on the masks and how it went. Observations, I guess, of people wearing masks where they should be at retail stores.
You're so quiet. I hear you have a question about masks, but that's about it.
Just wondering how the enforcement went. Can you hear me now?
Enforcement on masks.
On masks, how did they go?
So I think your question is about the governor's and my orders around face coverings. Is that correct? So we have generally not received complaints about people violating the orders, which has been interesting because with a lot of the other orders, we've received a handful of complaints about people gathering and those sorts of things, but we have not received a lot of complaints. If we do similar to with people playing at playgrounds or people gathering in groups, we would send the police department or the health department to a site to just remind the business owners about the order. Yesterday, I also put out a robocall to New Haven businesses outlining the rules around face coverings to remind them about their responsibility, but also to notify them that they had the authority to deny people access to the store if they were not wearing face coverings. The intention with this is to get people to comply. It's not to penalize people.
Thank you.
Does that get to it, Mary?
It does, thanks.
Yep. Back to you, Tom.
Thanks. Mayor, have any school maintenance staff or security or food distribution employees tested positive for COVID? And do you know if they've tested positive because of their work exposure through work?
Mr. Pinto, can I defer to you on this question about whether school maintenance individuals have tested positive? You're on mute.
We have had one custodian, 2 food service, and one security guard. We have obviously had to take some people out of rotation, mostly for for the precautionary precautions for quarantining. However, we've maintained relatively steady at we had maintained steady at 3. The most recent one was the additional food service person, who we believe works at the hospital as a second job, or one of the hospitals as a second job, and we actually think was exposed there.
And while I have you, Mr. Pinto, could you speak to any preventative measures that the schools have implemented recently to best protect these staff, and also how the 3-day-a-week distribution schedule is going?
Let me hit the 3-day-a-week distribution schedule. We think it's going pretty well. Obviously, there's a little bit of logistics challenges to it, but we are working our way through those. We did receive towards the end of last week a significant shipment of masks. They're effectively utility masks, face cover. It's a surgical style mask, although it's not a full hospital grade mask. But we have issued those, and we have a stockpile for at least a 30-day supply for our staff on the Board of Ed side. Excuse me. And we are working to secure more. Again, previously we'd had gloves on hand, and we have reiterated and reinforced the social distancing at the school buildings. For the most part, that has not been an issue because the buildings are effectively empty, except for, some of the bigger buildings have as many as 6 people in them total, usually 2 security guards, 2 food service workers, and 2 custodians. But other than that, the buildings are effectively empty, meaning that, in a 60,000 square foot building, everybody's got 10,000 square feet of space. Obviously, the 2 people working most closely near each other are the food service workers, as we have implemented and gone down to one person placing taking the order and placing the meals on a table and then stepping back. And the other person is more in the back and preparing packages. But other than that, I mean, obviously there's ample room for social distancing, and we have now been able to augment the protective equipment with the significant shipment of masks that we received at the end of last week.
Thank you. And Mayor, another question for you. With the CVS testing site now online and with these 3 others coming online soon, do you and your staff anticipate being able to report not just on positive infections or probable infections and fatalities? Do you think you'll be able to report on tests administered locally? As you've stressed, just the number of tests that need to take place is pretty critically important right now.
Yes, the short answer is yes, and I would also ask Director Bond to weigh in here. We've actually started to receive some negative results in data from the state, and are working through to make sure that that information is accurate. And that will give us a much better picture of what's going on, the full, not in a full picture entirely, but just a better picture of tests that are being conducted and the number of people that have access to tests. And so we anticipate soon being able to share more of that information with you all.
Yeah.
Dr. Bond, I don't know if you have anything to add.
Just to add to that, we are vetting through that data. And similarly to what the mayor reports daily regarding data, there's always going to be a lag time. And so we're vetting through that data now. We'll be presenting it soon. But just keep in mind that there's variables that we have to consider because of different testing labs not getting things in consistently. But we will at least provide a static view of where we are. And so we'll be able to do that in the very near future.
Thank you for that. And then my last question for you, Mayor, is about how the Board of Alders last night voted to allow the city to opt into 2 property tax relief programs. And you've spoken in previous meetings about how the city's taking a pretty serious revenue hit. I wonder if you could speak to what impact you anticipate these 2 property tax relief programs might have on the city budget. And also more broadly speaking, I mean, I know this is very breaking news, but it looks like the deal that Congress has stuck with the president, this latest relief package, won't have any relief for states and municipalities. I'm sure that might change, but can you speak to this larger issue of revenue significantly dropping for the city budget?
So what the Board of Alders voted on is a little bit, is only tangentially related to the revenue problem. Ultimately, the 2 options of a tax deferral or a tax payment with interest don't significantly impact our revenues. It's more of a cash flow issue. People eventually will be responsible for paying their taxes. It may be after 3 months. And typically the city receives much of its tax revenue in the first month or 2 of the fiscal year. And so us not receiving a lot of that money until 3 months later could potentially create a tax flow issue. We talked briefly about it yesterday on the press conference where the city in the past has used TANs. Mary, what's the tax anticipation notes? Thank you. I read your mind. tax anticipation notes to do very, very low interest borrowing to help us bridge the gap between when we may receive funds and when we have to pay the expenses. So that's one option on the table to help us address that cash flow issue should we have an extreme cash flow issue. But ultimately, what the Board of Alders voted on is unlikely to have significant revenue consequences. There are some questions about the economic impact of COVID-19 being so significant that people may not be able to pay their taxes, period. And I think it's very difficult for us to get a real sense of what the scale of that problem will be until we start to actually experience it. Separately from that, there are revenue issues that I've articulated previously around reduction in building permits, reduction in tax revenue at this time of year. Typically, this amount that we receive at this time of year is lower than at the beginning of the fiscal year, but nevertheless, it's significant. And then parking meter revenue and parking ticket revenue is down significantly. I will be working to get more accurate estimates of what that actually looks like in the coming days to share with you all. At the moment, I don't have a specific estimate of the cost of lost revenue. I do think that your question, and I'll take a look at the details of what you just mentioned around there being potentially some agreement on more federal subsidies. There's been a lot of talk about paying for our expenses that are related to COVID-19, but not as much talk about the significant loss of revenue that many municipalities will be experiencing. And that clearly will impact our ability to help support the many people in New Haven that are struggling, because much of the support that we give to the community, whether it's advocacy and support around homeless shelters, to other city supports around schools, will be significantly impacted if we do not have the kind of revenue that helps us pay for our budget. If people will remember, 2 months ago, I submitted a budget to the Board of Alders that was one of the most difficult budgets the city has seen in a long time because of the serious financial challenges that the city faces. COVID-19 is going to exacerbate that situation, and we will be faced with a much more challenging budget, especially if our federal partners don't help us address this problem.
Thank you. That's it for me.
Thanks. Any final questions? Go ahead, Mary.
Just one minute, just a clarification. There are three, you can hear, the three health clinics when they were talking about charges. I just want to make sure I understood. If the Hill Health Center, if that was going to charge for swabs or the administration of swabs, is that incorrect? I mean, is that?
No, we will not charge for those.
All right, so pretty across the board, the three institutions doesn't sound like it will charge for any of the patients that are coming. Is free of charge, period, for them.
Yes.
Okay.
Correct.
We will be billing insurance for those that are insured, and for those that are not insured, they will receive no bill from us.
Okay. All right. And just one question to Mr. Pinto. I know you listed the name or the positions of the people that have COVID. Did you say there's 3 others that are quarantined and you're waiting for tests?
No, there people who were working in, anyone who worked in the building with those people who we find out are positive, we've quarantined for precautionary measures, even though, and this is purely for precautionary measures because we anticipate that they're reasonably protected by social distancing practices. However, in an abundance of caution, we've quarantined people who are working with those people, not because we think that they're pending positives or awaiting tests, but because we're trying to be proactive and be safe.
All right, and that's 3. Is that the number?
I'll have to catch
number?
up. We have significantly more than 3 out at this point, because we had the first run we had to, yeah, I'll have to get you the number.
All right, thank you.
Thanks everyone again for joining. And I just wanted to reiterate, I know that it was a ton of work for our three partners to stand up these sites. It's so important to the community, and I wanted to express my deep gratitude for all the work you're putting in to make sure that testing is available to communities of color around the city. And we look forward to working with you and seeing the sites in operation.
Thank you, Mayor.
Thank
All
you.
right.
Thank you, everyone.
Thank you.
Thanks. We'll see you all soon.
Take care.
Thank you.